Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. As usual, I would like to talk about caring and sharing. Sharing those med moments, that moment which that chest pain or that pain in your knee, or that moment that makes you realize that you should take better care of yourself. That's a med moment. Email me, tweet me, www.medmoments.com, or tweet me at medmoments. That's at medmoments. Don't forget the S. Today we got a great show for you. We're talking about anemia, a problem that it affects so many people. And I have an excellent physician to talk about this particular topic. His name is Dr. Trevor Lane, and he's a hematologist oncologist. That's a mouthful. Dr. Lane, welcome to our show.
Thank you, Dr. Vitt.
All
Thank you
right.
for having me again.
Excellent. And yes, definitely. That is again because we get you back because I'm telling you, there are just so many topics to cover in your specialty.
Absolutely.
And anemia is one that so many people are affected with. I think that we should cover this topic so that we all are more educated as to and be better healthcare consumers.
Yes,
definitely.
we should.
Definitely. So I'm going to start with my usual question. What is anemia?
Anemia is essentially low blood. And some patients confuse it with low blood pressure. It may be related to your low blood pressure, or it may not be related to your low blood pressure. So essentially, anemia is when your hemoglobin drops.
Okay.
The normal for most people is between 11 and 16 for women, or between 12 and 17 for men. But it drops, and there are a lot of reasons why it will drop, and we'll discuss that. Just as a sideline, the blood contains three types of cells. We have the red cells, the white cells, and the platelets. Okay. The white cells fight infection. The platelets stops you from bleeding. And the red cells are what makes up your hemoglobin. It's what gives you strength. It's what carries oxygen throughout your system. Okay. So anemia is essentially connected to the red cells, and not the white cells or the platelets.
Okay. Now, you said a word that's and it's an important word, and I want you to see if you can explain it a little better for hemoglobin. Right. I mean, what is hemoglobin?
Hemoglobin is the molecule that is in the red cells that carries oxygen, essentially. Okay. It is a molecule that is made up of alpha chain and beta chain, and this is the molecule. It's a protein molecule that sticks to your oxygen and carries your oxygen throughout your system.
Okay, so how it breaks down, let me see if I get this right.
Okay.
The hemoglobin is a molecule that once the oxygen is in the bloodstream, it grabs the oxygen, or the oxygen attaches to it, and that hemoglobin is part of the red blood cell.
Absolutely.
Okay, and then it travels throughout the body and does what it's supposed to do.
Absolutely, that's exactly
all right.
All
right.
Yes.
Now, can the red blood cell carry more than, or the hemoglobin carry more than one oxygen, unit?
It can carry multiple oxygen units, yes.
Okay, so when my red blood cell is cruising through my bloodstream, it's got a whole lot of oxygen carrying it. It's just cruising with a lot of oxygen in the backseat.
That's correct.
All righty.
That's correct.
And as it goes through the body, what does it do? It just kind of throws a little bit here and there. And
it depends. It depends on on the demand of the body.
Okay.
If someone is exercising, it throws it mostly in the muscle. If they're not, it throws it mostly in the heart. So it depends on the section of the body that is calling for the oxygen. It goes mostly there.
Okay, so let's just break it down one more time. I know we're a little bit out of talking only about the red blood cell, but I just got to get this carrying system down. Now, when the blood is in the arteries, that's the red blood.
Absolutely.
And that blood is that the one that has a lot of oxygen with it?
That's correct. It's the oxygenated blood. That's correct. It has the most oxygen.
Okay. So then the blood is cruising, as I said.
Right.
It's throwing oxygen, giving free oxygen away to whoever needs it.
Right.
And then it gets to the veins. And then it gets to the veins, it's giving up most of its oxygen.
Absolutely. It's deoxygenated blood.
Okay, and then it's going back up to the heart and the lungs to get more oxygen. All right, so that's the route that that red blood cell is taking.
The circulatory system, essentially.
Yes. Okay, I got you. All righty. Now, why do people get anemia? I mean, why should this person have it and that person not have it? You know,
there are multiple reasons for anemia, and just in a nutshell, the anemia could be an acute anemia, meaning that it happens quickly, or it could be chronic, meaning that it happens over a long period of time. The acute anemias that we find mostly in our community, let's start with young females, is because of blood loss, because of menstruation every month. So you find that these patients will have a very low hemoglobin, usually between 8 and 9. Sometimes it drops much lower. And this is mostly exacerbated by fibroids, which is common in black females, as you know. And the fibroids can exacerbate the bleeding, even at the time when they're not menstruating, or it can prolong the menstruation. So you find that these patients present severely anemic, and we'll talk about it later, but they really need to continue taking their iron pills, and that doesn't happen generally. So that's the acute anemia. It could also get blood loss from the colon. In patients, if you go to the bathroom and you have dark stools.
Now the colon is the bowel, right? You're talking about
that's the bowel. That's the bowel. That's a large bowel.
Mm-hmm.
If you go to the blood and you have black stools, that's usually a sign of bleeding. Essentially, the hemoglobin is an iron molecule. When it gets exposed outside the red blood cell, it gets dark, it gets oxidized, and this is the reason why if you have black stools, that's a sign of bleeding. It's not a sign that you have anything that's good. That's a very potent sign of bleeding if you have black stools.
So it's not what you ate that was dark, and your stool came out
correct.
dark.
It's probably because you're bleeding.
Because you're bleeding.
Absolutely.
Oh,
yeah.
All right.
So these are in a nutshell, the acute anemias, and of course you can bleed from anywhere else in the body. You can bleed from coughing up blood, as you know, as a pulmonologist. You can bleed from your nose. In some patients that have epistaxis, hemophilia patients bleed all the time. So there are lots of reasons why bleeding, but in the community that we see, these are the two most common reasons we see. And this is the acute anemia. The acute anemia could also be caused if you destroy your blood cells. Certain conditions cause you to destroy your blood cells, like in lupus, that causes hemolysis. Especially in young females.
You're throwing these big words out here now. Hemolysis? I love it. Well, you're going to explain that one.
I will explain it. That's correct. Hemolysis is essentially when your body destroys its own blood cells. So essentially, the blood cells sort of blow up, and all the contents inside the blood cells are thrown into your system, and that's very dangerous. It's extremely dangerous. So that's the acute anemias, and the chronic anemias are usually caused by things like, of course, cancer and renal failure, and other conditions can cause that. That's in a nutshell. Of course, we have sickle cell disease, and there are a ton of other reasons why anemia is. Anemia, and I must say it, and I should have said it from the start, is not a diagnosis. Anemia is a symptom. We have to have the reason why you're anemic, right? You have, the ask patient, and they say, well, I'm anemic. Right, that's not a diagnosis. There are thousands of reasons why you're anemic. Anemia is not necessarily a diagnosis. Lung cancer is a diagnosis. Colon cancer is a diagnosis. They can all cause anemia, but they cause anemia for different reasons. All
right. So when you say a diagnosis, you mean the disease that causes the anemia.
Right.
That's what you say.
That is the diagnosis.
That's what a diagnosis is.
Absolutely.
Whatever that disease is
that causes the anemia.
That's the diagnosis.
Absolutely.
I got you.
Yes.
I got you.
Yes.
Can you get rid of it? Now, I got it. Can I get rid of it? You know the deal.
You can get rid of it, absolutely. At times it is difficult. For example, the patients that are sickle cell patients, they're born with sickle cell. They can't ever get rid of it. It's something that they're inherited. The patients that are the hemophiliacs, they're born with it.
Hemophiliacs, what is that? Somebody that bleeds too much or something?
It's a person that bleeds a lot because they haven't got certain clotting factors.
So if they cut themselves, they can't stop the bleeding.
They can't stop the bleeding, absolutely.
I got you.
So these patients really can't get rid of it if they're born with it. However, the patient that has fibroids and heavy periods, that is the common thing, they absolutely can get rid of it if they take the iron pills and they follow up with the GYN doctor, or they have a hysterectomy if they need to, or a myomectomy, meaning removing the fibroids if they wish to have children. So you can get rid of the anemia per se, but certain people, as I said, really can't get rid of it. It's part of who they are. It's part of the DNA.
What are if somebody presented to your office, what are some of the symptoms that you would look look for
Right.
as a hematologist
Right.
to say that this patient may have an anemia that I have to, follow
Right.
up with?
Well, the signs that those patients usually present with, and it could be very insidious. They would just think that they're just tired a lot, they have no energy, they are lethargic, they sleep a lot during the day, they can't run around with the kids as much as they used to. They'll find that they would be probably in the bus and they'll be taking a nap when they were taking a nap before. So they have, and you also find that if they're a person that exercises a lot, they have decreased exercise tolerance. They can't do the things they used to do before. But sometimes they don't even see it as a problem because it has been there for such a long time that they think it's just normal, but it's not normal.
Right.
They can get chest pains if they walk for a long time. They can get shortness of breath. And they can just, find something that happened also with patients is that they would, come into the office and they would say, Dr. Lane, I'm eating lots of ice. It's called pica. They would have these strange things where they eat a lot of ice, clay, starch, chalk. Those things are signs of chronic anemia. And the exact reason why they do it, we really don't know. But what stuns patients is that they would come to my office with a hemoglobin of 6, and I would look at them and say, well, how long have you been eating all this ice? And they would say, how do you know? Did my husband tell you before I came?
Right.
I said, no, he did not. I don't know who your husband is. But the fact that you eat a lot of ice means that you had anemia for a long time. If you have one of those strange symptoms, like pica. Yes.
Interesting.
Yep.
What about age? Are we more likely to have anemia when we get older, or or babies more likely to have anemia? Does age play a factor here?
Well, let's talk about age. Does play a factor. Since you mentioned babies, there's one thing that we should, there's, if you go on an airplane and they would, give you the instructions saying that if there is a loss of pressure or smoke-filled cabin, to put your oxygen mask on first before you put the child's oxygen mask. And most people would think that, well, that doesn't make sense. You got to protect the child first. The issue is that adults have what we call adult hemoglobin, because we're adults.
Right.
Children have fetal hemoglobin. Now, fetal hemoglobin, because they were fetuses, a child would have lots of that, but that holds on to oxygen more than our hemoglobin. This is the reason why, as an adult, you have to protect yourself first, because you will die before the child will die. I mean, we always hear on the radio that, or on the news, that some kid was in the bottom of a pool and they thought the kid was dead, but the kid was not dead.
Right.
That's because the fetal hemoglobin just holds on to oxygen. It has more of affinity for oxygen than adult hemoglobin.
So it holds it tight.
It holds it really tight.
Okay.
So you will die before that child will die in the same situation. The child will live longer than you do.
Interesting.
In terms of age does play a factor, and there are certain things that, of course, occur with age that does not occur usually in younger patients. And I use the word usually because these days we are finding cancer that is usually some cancers that we should find in older patients, we are finding it in younger patients. But when you get older, there is a condition called dysplasia, where it's like a factory. The bone marrow produces your red cells. Your bone marrow is in your chest, it's in your long bones, it's in your hip. That's the marrow. This is where your red cells are produced. As you get older, the factory kind of slows down.
So that factory that's producing, the
Produces-
factory gets a little
it
tired.
gets a little tired. And you find it doesn't produce the blood cells at the same pace.
Gotcha.
And the blood cells get large, they're kind of lazy. And this is a condition called myelodysplastic syndrome. It's a long name. It's called MDS. And this is associated generally with aging. Also with aging, you find, of course, the dictum is that the longer you live, the higher risk of cancer. The longer you live, the higher risk of lots of things, prostate cancer, and cancer that are insidious, that you would not necessarily have lots of symptoms of. Conditions like bone marrow conditions, like multiple myeloma, bone marrow cancer. They are conditions that can just creep up on you over a period of 10, 15 years, and you'll have no idea if you don't go to your doctor that you're sick until it's too late.
Okay, all right.
So there is a risk of increased anemia with aging, yes.
Okay, all righty. So anemia can hurt you in many different ways.
It absolutely can hurt you in many different ways. And I think that's what I speak to my young female patients about. Even because they've gotten so accustomed with a hemoglobin of 6 or 7, they do not realize that when you have anemia, you have decreased oxygen carrying capacity because you have decreased red blood cells. So your heart is stressed to pump really harder, to pump the little blood you have through your system so you don't pass out. After you've had this for years and years, your heart can fail. You get what's called cardiomyopathy. Your heart can get enlarged and get boggy. So anemia is not something to joke with. even in young females, and I've seen that, you could go into heart failure if you had anemia for such a long time, if you stress your heart too much.
Okay.
So even though it's, and frankly, and I would say that you don't want to have to get a blood transfusion unless you absolutely have to.
Right.
Everyone should try not to have to get a blood transfusion unless it's an absolute emergency. Because I had to work in the blood bank for 6 months. I know exactly how it's done. And the fact is that blood transfusions are not 100% safe. No one can ever tell you that. They would say it's 99.9% safe, but not 100%. So please, I think for patients, there are lots of things we can do. We can give them intravenous iron in their office. If they have a problem.
Intravenous means iron to the IV. Okay.
Right. Because some patients don't like taking the iron pills because it makes them constipated.
Right.
They get constipated with the iron pills. They don't take it because Dr. Lane makes me constipated and I can't go to the bathroom, and then they have to buy the Metamucil and they have to buy the Senokot. They don't like taking those things. So they would not take the iron pills. So we will give them iron IV through the veins in the office for about 5 days. And that makes your anemia correct a lot quicker.
It corrects a lot.
It corrects a lot quicker with
Okay.
that. It corrects usually within about 7 to 10 days you get a response to it. Unlike oral iron, it takes about 4 weeks sometimes or more to get a real response.
Okay.
I think that people should realize that it is not a joke. It is not something that you get anemic, you go get a blood transfusion. Prevent it. Prevent the blood transfusion at all costs if you have to.
Okay.
And you're hearing that from me, and I do that every day. It's something that you don't want to have unless you have to have it.
You had stated something, and I don't want to just brush over this one fact.
Go ahead.
You said oxygen carrying capacity.
Right.
Alrighty. And so what you mean is that the ability of the well, put it this way, how much hemoglobin can travel through the blood as it goes through the body.
Absolutely.
And if you don't have enough red blood cells,
Right.
then the heart, what it does is it beats harder and faster to get the blood to go through faster, so it can kind of compensate for low amount of blood cells, red blood cells in the blood.
Absolutely, yes.
Okay, all right.
And it stresses the heart over a period of years.
It stresses the heart.
Because the heart is a muscle. I mean, it stresses it after a while. And after a while, the muscle can give way and get weak.
So the muscle gets weak because it's overworked.
It's overworked. And that's called heart failure. And you can have heart failure
because
from
of
that.
anemia.
Because of anemia over a period of time, you can have heart failure. So it's not something that is benign. It can affect you over a long period of time, and it can affect your survival in terms of your longevity.
Right.
Because of course, heart failure is not something that is a benign condition, and lots of times it's irreversible. You can treat it. The doctor can give you medication to try to make your heart pump more, but it is not 100%.
Okay, all right then. What about as far as losing blood? I know that you were talking about the colon and the bowel, you're losing blood. What about things like trauma, or are there ways that you can lose blood that you don't realize you're losing blood over time?
Absolutely,
or something like that?
and the most common thing for that is blunt trauma. When some kid falls off a bicycle and he walks away because he's not bleeding. He's not bleeding from anywhere. He has a little bruise. He thinks he's all right. And 2 days later, he's found dead. What happened was that he bled in his spleen, because you can bleed internally and don't know you're bleeding internally. And I'm sure lots of people could relate to that out there. That, trauma, the spleen is an organ that, it's a blood box. It's on the left side. And you can bleed very much into the spleen and don't know until it's too late, until the hemoglobin is 2 or 3, and then you would die. So blunt trauma, meaning trauma where you don't see yourself bleeding externally, doesn't mean you're not bleeding. You could be bleeding internally, you could bleed into your heart, into your spleen. As you know, you could bleed into your lungs for a long time before you have symptoms. Depends on where you're bleeding. Right. So you can bleed and don't know you're bleeding, absolutely, until you start having symptoms.
Right. Well, another thing, chronic anemia, the things that would lead to kind of chronic anemia. I know there are certain disease states that would make you more prone to it, like possibly diabetes, well, and different types of cancers and stuff like that. But why would it just amazes me that a person wouldn't know that they, you know what I mean, that they would that this is not going on in their body. I mean,
they wouldn't know, because some people just think it's old age. They're getting a little bit older. You're supposed to feel that way. You're not supposed to feel weaker as you get older. I mean, you will have some joint pains and stuff, but you're not supposed to feel like an old person when you're in your 50s or 40s. I think some people just think that it's because they're getting older, and it's supposed to be like that, and the time is coming, and all that kind of stuff. But it's people need to get the physical examinations and see the primary care physicians on a regular basis, at least once or twice a year, and have your blood work checked, have your hemoglobin checked. It's a very simple test. It can be done in the doctor's office very easily.
All right, so it's just taking blood.
You're just taking blood. That's all you got to do.
All
So
right.
then take some blood, and you're okay.
Okay. What about gender? Male,
Gender.
female?
Right.
Is it more likely one gender to have anemia than the other for whatever reasons it is?
It's more likely that women will be more anemic than men for many reasons. One, women loses blood on a monthly basis because of the period. Secondly, because women are the child bearers, and when you have a child, essentially you should be taking iron pills for about 6 months after that delivery to replace your bone marrow iron.
Having a child, being pregnant.
Being pregnant
Draws the iron out of your bone marrow?
Absolutely. The baby has to, it's a little parasite in there.
It's taking all the nutrients. It's taking all the good stuff from you.
Taking everything from you.
All right.
It takes from you when it's in there. It takes from you when it's out.
Yeah, right. I got you.
So the baby is sucking everything in there. And your iron is not only in your bloodstream, it's in your bone marrow. That's the storage area. Okay. That's where it's made. So women usually get iron depleted. If you do a bone marrow in a pregnant woman that have had many kids, you won't find much iron in the bone marrow. So it takes about 6 months to replace that bone marrow iron. So women that have kids, one child or more, needs to take iron for at least 6 months.
Okay.
Even if they have no history of anemia, they need to take it just to deliver itself.
Okay. Let's step back.
Right. So women, because of menstruation, because of children, because of fibroids, they bleed. They have what's called dysfunctional uterine bleeding, where they bleed abnormally for long days. They have heavy periods, change 4 and 5 and 6 pads per day.
Right.
And of course, they have to check the GYN doctor and do a DNC and probably have these fibroids removed. Also, women do not have testosterone. Testosterone is a male hormone that increases. This is the reason why when there's a marathon, the women get a lead. There's a reason for that, because men usually have a much higher hemoglobin than women, because testosterone is an anabolic steroid. It increases the amount of red cells that you have. Okay. So men have an unfair advantage in that aspect because of increased testosterone. Because we have testosterone and women generally have estrogens. So women tend to be more anemic than men. Yes.
Alrighty. We talked a lot about iron.
Yes.
And I just want to be clear as to why we need iron. You understand what I'm saying? I mean, iron. But what does iron have to do with the picture?
No, it's important. And the three things we really need: iron, folate, and B12. Iron is part of the molecule, the globulin molecule, is an essential part that attaches to the oxygen.
Oh, all right.
You have to have iron. Okay. Folate is another part, that tetrahydrofluoride, that essentially attaches to the oxygen molecule. And while we're talking about folate, that is the reason why alcoholics generally are anemic, because alcohol decreases the effect of folate on the bone marrow. So alcoholics will be folate deficient. And they will be anemic for many reasons. They will be anemic because they have an ulcer, because they're drinking so much, and because alcohol itself has a toxic effect on the bone marrow. So it prevents it from working. It prevents it from producing the red cells.
Right.
And B12, of course, we know about B12 deficiency, which is also an important part of the whole molecule in the red cells that carry oxygen. If someone is B12 deficient, they become anemic also. Okay. So these three things, the iron, the B12, and the folate, are essential parts of the molecule that increases the oxygen carrying capacity in the blood. It is very important that those three things we talk about.
Okay, all right then. Yeah, let's just get a diagnosis. If somebody comes to your office and you need to diagnose that they have anemia, you think, what do you do to diagnose the anemia, and then what do you do to diagnose the type of anemia that they have?
Right. What you do to diagnose the anemia is that you simply, of course, you come in as a doctor, you do a history and a physical. You look at the patient, you look at the pallor. Usually you might compare.
Pallor, you mean whether their hands
color of the hand.
Color of the hand, if they're pale?
It will be pale.
Right.
It will be pale, and I will usually put mine next to them and see, what's the difference? And they'll say, oh, I never noticed that. So there'll be pallor, You look at the conjunctiva under the eye. This is the reason why doctors look at your eye, because he's trying to see if you're anemic. If your conjunctiva is supposed to be pink, it gets pale. All right? And, patients would tell you that they're more cold than usual. They, in the middle of the summer, they're wearing 2 jackets.
Right.
Because let's just remember, blood is heat. When you die and your blood starts flowing, you get cold.
Right.
So if your hemoglobin is low, you become colder. Okay. You have, you would not be able, you would have to put on lots and lots of layers to keep yourself warm. All right?
Right.
So the patient will have those kind of symptoms, and then you just take a blood test.
Right.
You do what's called the CBC, the complete blood count.
Right.
And that checks the white cells, the red cells, the platelets, and it also does a differential diagnosis of the type of white cells you have. And as I said, the average hemoglobin for a female is between 11.7 and 15, depending on the laboratory. For a man, it's usually between around 12 and 17. So you will do that, but most times, just by the physical examination, you can have a pretty good idea if the person is anemic or not.
Okay.
Most times.
All right.
And I see it every day.
Yeah. We're going to have to close up here. This was such an interesting conversation. Thank you for coming to see us and explaining anemia to us.
You're welcome, Dr. Ben.
In closing, all right, caring and sharing, www.medmoments.com. Email me, tweet me at medmoments. All right, never institute any change in your medical therapy until you consult your physician. I trust each and every one of you continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. Thank you for coming in. Yes, it was such a great show, man.